Hello, my name is Beyonce Ceballos, and my presentation is on avoidant personality disorder. So, what is avoidant personality disorder, also known as APD? It is an extreme social inhibition, inadequacy, and sensitivity to negative criticism and rejection. It affects the ability to interact with others and maintain relationships in day to day life. The symptoms of APD. The symptoms can include social inhibitions, feelings of inadequacy, sensitivity, fear to criticism or rejection, low self esteem, self isolation, avoiding work, social, or school activities. It is possible for other mental health disorders to occur during this time. The cause of APD. There are no exact causes, but there are beliefs to what the causes can be. Researchers believe that it can be genetic and environmental factors. It can also be from early traumatic experiences and childhood neglect. This could be children who would experience lack of affection, abuse, neglect, and or a low level of care, and could also be physical illness. It can be noticed in childhood and can usually create discomfort later in life, like early adulthood. How is it diagnosed? If the symptoms are present, the healthcare provider will begin with medical history and physical examination. The provider could use different types of diagnostic tests to rule out the physical illness and the cause of the symptoms. If they don't find any physical illness for the symptoms, they might refer the person to a psychiatrist or psychologist. Then they will use assessment tools to evaluate the personality disorder. In order to be diagnosed with APD, at least 4 must be experienced. 1. Avoidance of activities at work that involve interpersonal contact due to fear of criticism or rejection. 2. Unwillingness to interact with others unless certain they will receive a positive response. 3. Hesitancy in intimate relationships due to fear of shame. 4. Preoccupation with criticism in social situations. 5. Feeling inadequate and being inhibited in new social situations. 6. Perception of self as inept, unappealing, and inferior. 7. Reluctance to take risks or engage in activities that might result in embarrassment. Treatments. Psychotherapy is one of the main treatments for APD and can include cognitive behavioral therapy, which is thinking and behavior, and helps reducing negative thought patterns and building social skills. So types of therapy could be group therapy, which helps creating a safe space with other people, family therapy, to create a supportive environment that promotes growth and a healthy risk-taking. Therapy is likely to focus on overcoming fears, changing the thought process, and behaviors helping the person better cope with social situations. How common is it? It is estimated that 2.4% of the U.S. population is diagnosed with APD, and it affects women and men equally. The social impact for people with APD. They experience extreme anxiety, nervousness, and fear in social settings and relationships, leading them to avoid activities or jobs that involve being with others. They tend to be shy, awkward, and self-conscious in social situations due to a fear of doing something wrong or being embarrassed. It also causes fear of rejection, which makes it difficult to connect with others. Being involved in a relationship, people can be afraid to share personal information or talk about their feelings. It is difficult to maintain intimate and close relationships. So, other examples for social impacts from APD could be someone refusing a promotion because they fear that their coworkers will criticize them, or avoiding meetings for work or school, or making new friends unless they are sure that they will be liked. They are extremely focused on what other people think, especially with negative thoughts. So, how do people cope with ADP, or ways that you can cope with ADP? Recognize the signs or symptoms in order to work with a therapist and find ways to work around them. Involve friends and family in therapy so that they have a better understanding of the condition and what that person might be going through. Another way is self-care to find healthy coping skills. So these are my sources for my presentation, and thank you very much for watching. Goodbye.